the biggest problem with the healthcare market, unlike other markets, is that we have completely suppressed normal market forces. As a consequence, nobody ever sees a real price for anything. No patient, no doctor, no employee, no employer. And as a consequence, we have a bureaucratic, dysfunctional system in which we all face perverse incentives. And when we act on those perverse incentives, we do things that make costs higher, quality lower, and access more difficult than otherwise would have been. The way out of this is not so much to educate people, but to liberate them, to give the patients more control over the money. When patients control the money, the providers will compete. They will compete on price. When they compete on price, they'll compete on quality as well.
Let's take a look at the political landscape. How possible is this, or is this a pipe dream?
This is not a pipe dream. People are getting liberated all the time. People are going outside the normal healthcare system. And so you see entrepreneurs creating new products. What Walmart did the other day is an example of liberation. Walmart said, we're not going to send our employees to any hospital in our neighborhood. We're going to only send them to 7 across the whole country. If they get on a plane and fly to these 7 hospitals, we'll pay the whole freight. If they want to go someplace else, they'll have some out-of-pocket expenses. It could be $5,000 or more. So that's an example of an employer doing something pretty radical to step outside the normal third-party payer system. We need to do 2 things. First, we need a level playing field, so we don't subsidize employer-provided health insurance and penalize individually purchased insurance. So treat all insurance the same, and then the employer-provided insurance does not have an advantage. If employers have something to offer to their employees in this field, they will do so. If they don't, they won't. The second thing we need to do is we need to promote portable insurance. Right now it's illegal in this state and every other state for the employer to buy individually owned insurance. Your employer can buy a Blue Cross group, but it can't buy Blue Cross individual. And that means that when you leave this employer, you leave your insurance behind. So we ought to reverse that and encourage employers to buy insurance for the employees that they can take with them from job to job and in and out of the labor market.
Is there a scenario in which a statewide individual mandate works? I mean, is that what's going on in Massachusetts, for example, what they want to do across the U.S.? Is it possible that can work state by state?
We don't need a mandate. What we need to do is offer people a generous tax subsidy if they get insurance. If they turn down that offer, they will pay higher taxes if they remain uninsured. You can call that a financial mandate if you want, but that's all we need. Once you start specifying what the individual has to buy, then all the special interests come in, as they did in Massachusetts. And you'll get the acupuncturists and the in vitro fertilization folks and the naturopaths, and every special interest will want to be part of that required health insurance plan, and then it will be very expensive.